Okay, thanks, man. Okay, sounds good. So how long have you had this hernia for?
Well, I just found out it was a hernia today. I wasn't really sure what it was.
Okay. Any nausea or vomiting?
This week, yes.
Okay.
That's what started everything.
Okay.
Oh, Tiffany.
What medical problems does your doctor see you for? Anything?
Endometriosis.
Okay.
Occasional cysts.
Like ovarian cysts?
Yeah.
Okay.
Gabby.
Yeah.
Do you take any medications on a
What
daily
room is
basis?
that one? 30.
No. Do you drink? Do you smoke? Any drug use? No. Okay. When's the last time you had a bowel movement?
Monday.
Today is Saturday. Okay. When's the last time you passed gas from your body?
Thank you.
Monday, Sunday, or Monday.
Okay. Alright. So if I take a look?
I don't know what's wrong with her.
Do you normally have something kind of bulging out of your belly button?
Yeah.
No. How long has this been bulging out for?
About 2 weeks.
Okay. That hurts?
Yeah. Really the right side. It's like a burning sensation.
Okay.
Like heartburn almost.
But if I take a picture to send to my boss?
Sure.
Okay.
I know they did take CAT scan.
Yeah. Did
We
you
did
go?
an X-ray. X-ray.
Oh.
They did an X-ray. They didn't do a CAT scan yet. They didn't go. You didn't go to CAT scan, right? Just X-ray.
I thought it was a...
Did you go in a tube?
No.
Then no. Tube.
Okay.
No. They X-ray called me, but I had to get orders for you, so. I was like, no, CAT scan didn't call me. X-ray called me.
And I'm sorry, you are?
I'm her sister.
Sister, okay.
Yeah.
So, a couple things. You're very distended. Your abdomen's very big. We can see it just by looking at you and also on the x-ray. What I'm really concerned about is that you have a piece of bowel stuck inside the hernia that's dead. What happens then is it backs everything up. Think of like a hose that gets kinked. Things can't move through.
And she was talking about a bowel obstruction.
Which is what that would cause. You know, just looking at this and the irritation to the skin and stuff around it and what the bulge out of your belly button looks like, that's what I'm mostly concerned for, okay?
Right.
So the CT scan will give us a better look at it, but just looking at it clinically, that's kind of where my mind is going, okay?
Yeah, that surgery.
That means surgery. It means surgery with probably taking out that piece of bowel. You have a lot of bowel, you have more than you need.
Oh my
Oh,
God.
okay.
So taking out a small piece is
I'm like, what does that mean? Will I not be able to go ever again?
no, you can't. So taking out a small piece of bowel is not a problem.
Okay.
The problem is we don't know how much is affected by this. So the plan, and I'm gonna talk to my boss, Dr. Lowe. You never had surgery before, right?
No.
You've never seen a surgeon here before?
No.
You ever been to this hospital before?
Yes.
Okay. What for?
My grandmother.
Okay, but as a patient, have you ever been here as a patient?
No.
Okay. So I would talk to my boss, Dr. Lopez. He's on call right now. I'm going to recommend we go to surgery here in the next couple hours.
Will you give me the pink top that I'm gonna dry typing screen?
Yeah, that'd be great. The
Yeah,
pink?
the pink. That's the typing screen.
Do you have coags over there?
I do. Coags,
DMD,
lactic,
CBC, okay.
yeah, all the things,
And then.
and liver
what-
functions.
Perfect.
I guess you can actually tell me that in a little while. Like what type of, like what's the name of the surgery?
It's going to be called an exploratory laparotomy. It's an incision down the midline.
Like a big one,
It's probably going to be not small. Yeah.
Hmm.
I would talk to him if he thinks there's a chance that we can do it a different way, then we might. But just based on how this looks, I think we need to get in there and take a look.
Yeah.
I think it's going to require us taking out a piece of bowel. If we can, the preferred would just be to immediately hook it back together.
Okay.
I don't see a reason why we wouldn't be able to do that. If for whatever reason we get in there and we can't hook it back together, then it could require making some sort of an ostomy with the bag. I don't think we're there. But I just want to tell you that that's a potential. Those are
What's that?
an ostomy. You ever seen those things that people have like little like piece of bowel sticking out with a bag over it?
Oh, like a colostomy?
The
bag?
colostomy, yeah.
Yeah, that's
Yeah.
exactly what it is. Yep,
Yes,
colostomy,
exactly.
And I would have to wear that?
You would.
Just for temporary.
Again, right. So those are reversible. And I don't think that that's where this is headed. I don't think that's where this is headed. But I want to warn you that it's not a 0% chance just based on how things look inside. Okay? The other thing I want to do in the meantime is I want to put a tube down your nose to start sucking all the air out. Because you're very distended and it puts you at a really high risk of two things. One, your bowel perforating, meaning popping a hole in it, which can get very bad very fast and can result in a colostomy because of like bacteria and stuff in your belly. But also it can make you very sick and that's what's causing you to throw up. So I'll be honest with you, they're not the most comfortable things, but it should make you start feeling better pretty quickly once we start sucking all that air out.
She has, I think they gave her some morphine.
just
Is
gave her
there,
morphine.
will that help like take away the discomfort from the nose thing?
Maybe a little bit. There's kind of two sides of the nose tube. Number one, once it's in for about an hour or so, it's going to irritate the back of your throat just while you get used to it. That's normal. Really placing it is the most uncomfortable part, and it takes about 30 seconds to a minute. All right. What questions can I answer for you?
I don't know, my mind is like everywhere.
That
I
was
know.
a lot of information.
It's a lot of information.
yeah.
It's probably not what you were expecting. Like I said, I'm going to talk to Dr. Lopez. I think we're going to still wait for the CT scan
Oh.
just to be able to see what's going on for sure. But I want to get that tube in your nose even before then. Because I'm really worried about how distended you are.
That's my worry is in talking about colostomy bag and about, well, I don't know, I guess I could talk to you.
Yeah. I don't think we're heading towards a colostomy. To be honest with you, I don't.
Or even taking my bowel, I guess nothing will be like, what does it look like after the surgery?
If we can hook you back up, nothing different. If we can attach those two ends back together, which I think we probably can, you'll be here for a couple of days. We'll slowly ease you back into eating or drinking just because your bowels are going to be very irritated after all this.
Yeah.
Sometimes they go to sleep for a couple of days. So we watch you for a couple of days.
I'll be right back, okay?
We ease you back into eating and drinking and make sure that things are waking up and that you're passing gas and everything. After that, once you go home, eat, drink, you live your life as normal.
Okay. Well, would there be another option? Say y'all got in there and you're like, oh yeah, we gotta take a piece of off. About is that an option or it's like it wouldn't be an option?
If we were taking bowels because the bowel's dead. I think there's bowel stuck up in here that's dead. I think one of the reasons that you're not very sick right now is because think of a hose, right? If you twist it, all that water in the end is stuck there, right?
Mm-hmm.
What happens when you get bowel stuck is there's not blood going in, so it dies, but there's also not blood going out. So all those toxins that are accumulating are kind of stuck there. So I think that's one of the reasons why you're not super sick.
And then how long is the surgery?
Surgery probably about 2 hours. It'll seem a little bit longer to your sister because you'll go to pre-op for a little bit and then we'll take you back and then you'll be in post-op for a little bit while you wake up and everything. But from the time you go to sleep to the time you wake up, I'd say probably about 2 hours.
And I'll be like knocked out.
You'll be asleep.
I don't have excision and
I know.
Okay, I'll be over there.
This is really crappy news and I hate telling it to people, but just looking at you clinically, I think I can tell you what the CT is going to say. Okay. So let's do this. Take a second, kind of process the information. Think if you have any other questions.
Okay.
I'm gonna go give Dr. Lopez a call. All right. I'm gonna call one of my other residents also. Ask her to come see you, and then we'll come back. We'll chat again. If you have any other questions, we can talk. Okay. All right.
Alright, I'll be back, okay? I'm gonna go, they're just paging me for another patient.
Okay.
But
You finally got it?
I did. It just the blood was coming really slow. So I drew extra because I'm hoping the blood doesn't clot. Because a lot of times when it draws slow, it clots and stuff. And I don't want to have to. But I got it. We got the blood. I got extra blood too. When he told me what I kind of, so when you order extra stuff, I'll just send that extra down too. And then I'll be back to put the tube in your nose. But I have to go see this other patient is paging about, okay?
And there's nothing, like when they put the tube in, there's nothing more we can do to make that less, okay.
Unfortunately, it's just no. There's
Okay.
nothing we can do. The worst is just once it's in, and then obviously, it's like you said, irritating your throat. But that's very necessary
Okay.
because, to be honest with you, like that doesn't look good. So that's
Yeah.
why we need to get the pressure off.
Yeah.
Because I know you're having a lot of abdominal pain, but once we remove some of the pressure, you're gonna feel better. So
Yeah.
that tube going in to suck some of the stuff out, and because it's gonna remove stuff, you're gonna have less abdominal pain, but you're gonna have throat pain. Like it's
Yeah.
not pain, it's gonna be like irritating.
Yeah.
Does that make sense?
Yeah.
Yeah. Okay, let me put this. There's something. I'm just gonna put this above where I do the blood. Okay.
Wow.
Yeah. Okay, I'll be back. Okay. Is the pain better after that too?
Yes.
Okay, good.
Well, that's good. That's good. If you're feeling a little better. I definitely think the surgery is very necessary, obviously, so.
Of some sort. I'll give you towels.
It's necessary, but
Yeah, I'll leave this. Actually, I'm gonna leave this here. So if they order it, it's labeled, but I can't send it because that's one I can't send because they'll throw it out.
Oh.
Everything else I can send though. Okay.
definitely gotta have it.
Yeah.